Blood pressure then. Now, lots of different parts of your body have to have certain levels, certain pressures within them. And a lot of that pressure is derived from fluid, and a lot of that fluid is derived at some point from the blood system. So the blood has to exist under a certain pressure as well, if that is going to equate to health. Yeah? So we have standards for various parameters within the body. And the standard for blood pressure, does anybody know what it is? Right, the standard for blood pressure is 120 over 80 millimetres of mercury. Now, the 120 over 80 is the sort of thing that you will find in textbooks as your set figure. But in actual fact, 120 over 80 is not necessarily realistic if you've got something like a 70-year-old person sat in front of you. So what we tend to do is to think that the big number should approximately be 100 plus the person's age. The little number, I'll tell you what they are in a second, but the little number should show little variation. So I took my blood pressure the other day. We have blood pressure can be taken with a very standard way, or you can get little digital machines that do everything for you. And we have one of those in one of the clinics, and somebody thought that it wasn't working very well, so I stuck it on my arm to test it out. And my blood pressure came out at, I think it was about 138, 139 over 81. Perfectly normal. It doesn't fit 120 over 80, but then this is your textbook normal, which isn't terribly realistic. You've got to use it a bit liberally. And 100 plus the person's age is generally the acceptable area. However, having said all of that, there are new guidelines that have been issued which says if the blood pressure is creeping, if the upper number here is creeping above 140, 145, then it should maybe be considered as high blood pressure. Now these things change a lot, so you need to just keep your eye on this particular area. And blood pressure again can be used more as an indication of things rather than as a specific measure that is diagnostic of something. So you maybe take somebody's blood pressure just to assess and couple that with all sorts of other information you have about the case before you decide what you may or may not do with that patient. Now the upper number, the big number, if I write it out again here, the big number is what we call the systolic pressure. And the lower number is the diastolic pressure. So the big number systolic, the lower number diastolic. Systolic pressure is when the heart contracts, and diastolic pressure is when the heart relaxes. Diastolic pressure is also, in effect, the standing pressure in an artery. So the heart contracts, and you get this surge of blood into the artery, and the pressure increases because of this surge of blood, in line with the heart contracting and chucking blood out. Yeah? The heart relaxes, and the artery walls that we talked about doing this sort of thing, the artery walls go back to normal, and that's your diastolic pressure. It's like the set pressure within the artery without the force of blood from the heart. So systolic, the high number, diastolic, the lower number. Okay? So everybody happy with that? Right. In that case then, think a little bit about how we take blood pressure. And we'll have a little play with the stethoscopes and the sfigs. So in order to take blood pressure, we use a stethoscope and a sphygmomanometer. Now we have some stethoscopes here for you to play with. But let me just talk you through them first of all, because lots of people think, oh great, you know, brilliant, a stethoscope, whack the things in and oh, I can't hear anything. There is actually a way of using them. The sorts of stethoscopes that you've got, you can buy for about £15–20 or so. They're the sort that you've got. Mine, which is a Littmann stethoscope, is about 60 quid. But it's the sort of thing that you can buy and it'll last you till the cows come home. So it's worth the investment to get a slightly more expensive one. Now, all stethoscopes, or most stethoscopes, have two sides to them. So we have this flat diaphragm, the big disc, and then we have the smaller, more hollowed area called the bell. So those two areas. And you are able to swivel the lead into the head of the stethoscope around. Yeah, those of you who got them can do that. Now, if you look into the bell, you can see a small hole. Yeah? Now, as you watch that hole, turn the barrel of the lead going into it, and you can see a little hole appear and disappear. Yeah? Now, what you want, if you're going to use the diaphragm part, make sure that that little hole in there has disappeared. That means that the little hole that's within the shaft part here is now pointing towards the diaphragm. So as the sound waves hit that, they can be conducted through the hole and down here. And this bit is now closed off. Yeah? If you wanted to use the bell, you just turn it so that the hole is there and then you can put the bell on. Generally we use the bell for lower pitched sounds, for greater clarity of lower pitched sounds. The bell is also quite good if you've got somebody who's got quite a hairy chest, because when you put that on you get a lot of rustling. But we'll think about hearts. We'll think about hearts at a later date. Okay? So make sure that your little hole here is in the right place. So if you're going to use the diaphragm part, which we are, you want your little hole closed off. Okay? Now, the other important bit is about the earpieces. If you look at your earpieces, they may be straight or angled. You can see mine are angled. Yeah? And the way you put them in your ears is important. You want to put them, if they're angled, put them in your ears with the angle pointing towards your nose, because your ear canal goes into your head and slightly forwards. If you put them in the wrong way round, then the earpiece literally just sits in the back of your ear here and you can't hear anything. So it needs to go forwards, fit snugly in the ears, and then you can hear quite clearly. Okay? So that's how to use the stethoscope. It's how you would use it when we want to take blood pressure, when you want to listen to a heart, when you want to listen to somebody's chest, when you want to listen to somebody's gut for bowel sounds or something like that. Okay, so you always make sure that your little hole is the right way round and make sure that your earpieces are in straight. I have so many people who just whack them in and say, I can't hear anything. And generally speaking, they've got this the wrong way round or they've got these in the wrong way round. It makes a big difference. Now, how do we take blood pressure? Well, we also need this other little bit of equipment called, called a sphig for short. And you can see it consists of a cuff which has got an airbag in it, a lead, and a little monitor that we can use, and the bulb to pump it up. So we can pump that, and those of you who are closer can see the cuff pumping up. Yeah? So that we can fill the cuff with air. See, it's getting quite fat. And there's a little valve here that we can use in order to then let the air out. Now, as I said, there are some digital blood pressure machines which you can use in order to try and take blood pressure. Generally speaking, the accuracy of those is a little bit iffy. If you know how to use this more manual system, then it could be that you have a greater degree of accuracy. But generally speaking, what we do to try and account for accuracy is that we take a blood pressure and we sort of think, okay, 5 millimeters of mercury either way, and you're within the right area.